STP stands for Sustainability and Transformation Plan. That means that we're working together across South East London with commissioners, hospital trusts, community providers, general practice, the public, voluntary sector and social care to design services that we think will ensure the delivery of high quality care for the population of South East London over the years to come. OSL stands for Our Healthier South East London, and that's the name given to these plans because not only do we want to sustain the care that we deliver, but we want to improve the impact of that care to get better outcomes.
I've been working in Lambeth and Southwark for nearly 15 years now, and I love working with such a vibrant and diverse community. We know that across South East London we've got some really excellent health services, but we also know there's a lot that we could do to improve them. We think that by working across the 6 boroughs together, we can learn from each other and achieve more.
At the heart of the South East London programme is improving the offer to our people. A more immediate, more local, more comprehensive, more friendly and personal offer to the people in our communities.
I'm Ros Luff. I'm a patient and public representative on the advisory group for our Healthier South East London programme. I've got a wealth of experience of caring for a child myself with a disability. Sometimes our families fall between 2 stools. It may be that they receive healthcare services and then that stops and there's no social care. Sometimes it can be a bit of a maze to get to those services for our children. So we just want to work together to make those improvements get the best that we possibly can in the landscape that we're in.
I'm John King. I retired from medical profession 5 years ago. For 30 years I've been a patient of the NHS, and for the last 4 years I have been a patient representative. Medicine now is very much a case of cooperation between patient and doctor. They're part of a team.
I'm Shri Kaladindi. I'm a consultant psychiatrist at the South London and Maudsley Trust. It's absolutely imperative that for those who have mental health conditions that we properly attend to their physical health care too, and through the whole integration programme that is something that I very much want to improve. Some of the exciting things I think about this integration work is really focusing far more perhaps than we've been able to before in prevention, so getting in early and thinking about what are those factors that we can change that really help people to reduce their risk of becoming unwell.
The communication and continuity in some parts of my care is excellent, and it is so reassuring for me to know that they are working closely together. I'd like to see this throughout it all. I feel with some imaginative planning it would be possible to have a specially trained carer who could provide all my support. This would also free up district nurses to focus on providing medical support in the community, maybe combining their budgets too.
In South East London, we have some incredible world-renowned services. Unfortunately, that's not the case throughout the whole patch. There is variability. What we want is for all the services to be lifted up to that high level so that wherever you are, whether you're accessing community or hospital services, that you can expect that world-class standard.
I live to tell my story. I'm in remission, 5 years in May. When I first got diagnosed, I didn't think I would survive it. I'm grateful for all the doctors and nurses who looked after me within the NHS. Every patient's voice matters, and you can only get a system right if you get the people who actually are part of the system. Let them give you feedbacks how and what they went through. NHS is our system and it's for all of us, and we all need to get involved. I don't think it will work if we think the bosses in the office sit there and write the system out and it will work. We as patients need to get involved, the public needs to get involved, everyone needs to get involved, and we'll have a better NHS.
If we're to give people the sort of health service they want for the future, one that joins up care, one that helps to support them manage their own illness, and one that prevents ill health and disease, then we're going to need a very different workforce, and they're going to require a whole different skill set.
We have spent a lot of time listening to patients, carers, and the staff who provide your care to hear what you have to say about what you want from the system that we all share. What we all want is that all the staff are communicating and coordinating your care so that it is absolutely seamless from the beginning to the end.
What's the guarantee that this plan is going to produce better health and social care?
We want to ensure that everyone gets the right care when they need it. So by getting organisations and services to work together better at a local level, such as GPs, pharmacists, community nurses, the voluntary sector, mental health teams, specialists for the elderly, for instance, and by helping the way they share information and come together to plan for people, we think we can get much faster and better care for people when they really need it.
Or are you planning to improve the link between health and social care?
One of the areas we've been looking at particularly is how we create something called local care networks, or for instance in Bromley that's an integrated care network. That means that GPs along with other services can make sure that plans for patients are built around their needs, and this is a new way of working, but we believe it's going to transform the way that care is delivered, and if this is done across all localities in South East London, it really makes a difference to the whole system, and that's one of the ways that we hope to see improvements in the way care is delivered.
We're working to improve health and care services for everyone in South East London.
Sometimes it's hard to know what service you need
or where to find it.
And not everyone gets the same quality of care.
We want to be able to give the residents the help that they need.
And give local people better support.
To help me live healthily
and keep well.
This support can be from lots of different organisations.
We want to bring together GPs,
community nurses,
therapy services,
health visitors,
community support workers,
social care and pharmacists.
To work together to support me and my family.
Residents tell us that they prefer to use their services within the community.
And only use hospitals when they really need to.
And keep A&E for people who are critically ill.
At the moment, people often have to contact lots of different services and organisations to get help. It can be confusing, and they might have to repeat their story every time. Things need to change. We want our services to be focused on you, supporting you to keep healthy and well with quick and easy access to care if you need it. So we're changing the way we work so that local services and organisations work together better, sharing information and resources to make every contact count. We will help you access the support you need when you need it. This might be from a GP, pharmacist, community nurse, social care or voluntary group. Services will work with you, whether you're a patient or carer, to understand and meet your needs in the most efficient and effective way possible. Helping people with long-term conditions like heart disease, diabetes or asthma to manage their conditions better, and supporting everyone to be healthier by helping them to set and achieve goals such as stopping smoking or exercising more.
The NHS belongs to all of us.
And we can all do our bit to improve it.
By keeping healthy
and working better together.
So I can use my skills more effectively.
We can make it better for me.
And me.
And me.
And me.
And me. And me.
How is the money going to be spent? And does this mean that there are going to be more cuts?
Our plans are about improving the value that the NHS gets for every pound it spends on care. But as well as getting cost improvements in the way that we do things, we believe that we will get improvements in care and clinical quality. In fact, if we don't do things differently, we estimate that by 2021 we'd probably have to build another big hospital with about 700 beds in it. So it's really important that we find new and better ways of delivering care, that the NHS can sustain the quality and standards of care it needs to.
Will there be more privatisation in South East London?
So the STP is not about privatisation, it's about the NHS planning together with its partners to ensure it can deliver high quality and safe care for its population over the years to come.
How will you ensure that everyone has equal access to care and services?
One of the main aims of Our Healthier South East London is to ensure that everybody has access to the same high standard of quality of care. At the moment in South East London, we know that although there is great care delivered, it's also not delivered consistently. And in fact, sometimes it depends on where you live as to how long you're actually going to live for and how well you're going to do with particular conditions. We want to reduce that inequality that exists, and we're going to have to focus on some important things like obesity, smoking, and education about health, as well as ensuring that all of the services that people can access are there when they need them and delivered to the same high quality standard in a consistent way.
How far do you intend to use patients in the design and delivery of services?
So I think it's really important that patients are involved in the plans that we're developing for the NHS. And by working with public, patients, the voluntary sector, patient advisory groups, Health Watch, we've been able to improve some of the ideas that we've had around the models of care. We want to carry on doing this, and in fact you can get involved with your local CCG by joining their patient advisory group, or perhaps some of the service redesign engagement meetings that they have about particular services in your area. It's really important that we do this together to make sure that we're delivering quality care in the NHS.